Welcome on, let's call this belated One Health Day, because most of us don't enjoy working on a Sunday. So we're taking the spirit of One Health Day one day further. And I'm pleased to be joined by an excellent panel today. But first, I'd like to just get a little bit warmed up and essentially give you a bit of an introduction to the topic, why we're having this event today. So essentially, our aim is to raise awareness about the topic of One Health and have important conversations about how it can be further implemented into our health systems. So as a brief refresher, One Health, and I'm going to be brief with the definition, I'm sure we can expand upon it throughout the day. It's an approach to health management that brings all parts of society and governments together to tackle the joint problems of human, animal, plant, and ecosystem health. So One Health is based on an understanding that the health of ourselves and that of animals, plants, and ecosystems are all interdependent. And this approach essentially presents a way to promote the health of all and to navigate the inevitable trade-offs that we will have when we make our decisions about health. So in the face of worsening climate change, accelerating biodiversity loss, pandemic threats, and threats from superbugs resistant to antibiotics, our governance structures at the moment are largely designed to be reactive rather than preventive. And often they're not well coordinated or properly funded. And this is true both at European and national levels. The state of play undermines our readiness and response and effectively weakens our collective health. So with that said, I'm honored to be joined today by a panel of experts spanning topics from public health, One Health, health system collaboration, and health management. And over the course of the next hour, we hope to shed light on the critical considerations of what One Health really means, what it means to us as health managers, clinicians, policymakers, and citizens, and why it's so important and what we can do to effectively foster change. So it's my pleasure to introduce Professor Maria Jeftic, who's professor at the Institute of Public Health of Vojvodina at the University of Novi Sad, and is also the chair of EHMA's Special Interest Group on One Health. We also have Dr. Milka Sokolovic with us. She's the Director General at the European Public Health Alliance. And we're also pleased to be joined by Eric Ruiz Martin, who is the Safer Pharma Program Manager at Healthcare Without Harm Europe and the project coordinator for AMR Educare, which we will maybe expand a little bit on later. So I'll just do a bit of housekeeping before we really get started. We'll be asking each of these experts to share some of their experiences and their work as it relates to the One Health concept in turn, followed by kind of an open discourse. But just as a note to our speakers, of course, if at any point you feel like jumping in on the points of your colleagues, please feel free to do so. That's kind of the format and forum that we have today. And of course, I'm here to facilitate dialogue and ask any pressing questions. But I would also like to take this opportunity to ask and invite any and all of our audience members to submit their questions in the chat at any time. We have my colleagues here who are monitoring it. I will be monitoring it as well, so that we can really expand our conversation into a more interactive experience. So with the housekeeping out of the way, it's my pleasure to turn first to Professor Jeftic, who is going to help us set the stage even further for our conversation this afternoon. So Maria, as the chair of our special interest group on One Health, can you get us started by telling us a little bit about the work that you've been doing with this special interest group and the report that is actually going to be published today? And just as a note, before you get started, to our colleagues to please post the link to that report in the chat, just so that everyone has access.
Thank you, Zach. First of all, thank you for organizing this event. I think that this is a great opportunity to discuss about One Health. First of all, I would like to underline that I'm coming from preventive medicine, from public health community of health professionals. And for me, it's an honor to be chair of special interest group in EHMA. But before I discuss EHMA, I would like to just discuss a few words about One Health approach. For me, this is not a new approach because I'm coming from preventive medicine. And as you mentioned that Today, healthcare organized more in reactive than in preventive approach. I think that my field of interest always was pointed to health, not to disease. And One Health approach, it's primarily has health in approach in a form. So health, it's also not a privilege only to human beings. That is the part of my specialization, hygiene, that health is not only privilege of humans. So we need to think much wider, think about animal health and environmental health. So One Health approach is, we can discuss it later, one new design of preventive medicine and approach to bring again preventive medicine in the focus of interest. And I think that it's very important. Then, when we talk about health management, I think that it's very important to raise awareness to healthcare management, human resources, to bring One Health approach as a capacity, as a tool to with the aim to better organization and more efficient system. So in shortly, special interest group of One Health, it's also multidisciplinary group of people dedicated to preventive medicine, public health, planetary health, global health issues. And we are dedicated to connect all these One Health approaches with health management, with the aim to improve health management and with the primary task how we can bring better results to our patients and to human resources in the health management system. That is in the short for the first.
And it's a great way to kind of get us started. So would you mind expanding a little bit more about the work that you've been doing with the group and the report that you published and essentially the definition of One Health management as you and your colleagues have found it?
Yes, we discuss a lot about that we should publish something to just to disseminate our thoughts with other professionals, and we prepared the One Health management perspective paper discussing the importance of One Health in health management, where we wrote that One Health management is a comprehensive and strategic approach that integrates leadership and coordinations across human, animal, and environmental health sectors. It is very important because of capacities of all these systems, and it emphasizes the interconnectedness of these domains and the need for an integrated and refined management framework to address complex health challenges. One Health management extends beyond traditional healthcare settings by incorporating behavioral, social, and environmental determinants of health and aligning with the related policy areas. It involves collaboration among a wide range of stakeholders, including health managers, healthcare professionals, policymakers, public health experts, and various industry professionals to develop and implement strategies that promote optimal health outcomes across the entire ecosystem. It is very important, and I would like to underline that we also should deal with how we can bring together social sciences and our sciences in medicine, veterinary medicine, and engineering. So it is very important and big challenge for us.
Indeed, it is. And actually, that's going to be a question that comes up a few times today, I think. But from your experience in trying to develop this definition, especially with given this diverse group of stakeholders from different sectors, can you tell us a little bit about what the experience was like trying to align all of these different perspectives and have people essentially from different sectors speaking the same language so that they could really develop this definition and agree on something?
I think, for example, that antimicrobial resistance is excellent example. The same interest of veterinary medicine and of pharmacy also, and human medicine. So different kind of laboratory we develop in veterinary sector and healthcare sector, so we can working together. And also we need for achieving our goals, different kind of changes in educational process, not only at medical faculties, but also in other veterinary medicine and biology, pharmacology, etc. And I think that we need interdisciplinary studies, master studies in One Health. I can say one example from Serbia. University of Novi Sad is a member of UGLOH Alliance, European Global Health Alliance universities, 9 universities. And for example, I was active last year, and I will stay inactive in online courses for students in climate action for health. For example, climate action is important for One Health and in veteran interdisciplinary approach. And also we can cooperate with other faculties. So one keyword for One Health solution is also education and reorganization of healthcare system. It means education through the university, but also lifelong learning of human resources in the healthcare system. So I think that we have excellent member of special interest group. Some of them are here, and I would like to thank them for all their effort to prepare our first paper in One Health and health management.
Great, thank you. And just as a probably not my last reminder, but maybe second to last, that is in the link if you're interested in reading it after this meeting. And actually, Maria, thank you, because that's a very good segue to perhaps a question for Milka, because you mentioned a lot, Maria, about the importance of education and aligning the objectives that we have when we educate healthcare practitioners, public health professionals. But I also see a very important role for civil society and different organizations, perhaps with different priorities and different agendas, also being able to work together in, well, let's call it a social approach and through that same type of collaboration. So Milka, I'm curious if you can expand a little bit or share a bit of your experience on how you've been able to, or how it even is possible to align some of these different organizations and diverse stakeholders kind of into the same aim, let's say, of expanding One Health into our health systems.
Simple answer, not easy. And then a question back, how much time do you give me to answer that?
Oh, you take as much time as you need, indeed. We have lots of time, so.
Thank you, Zach. And thanks very much for inviting me and for having me here. Really, it is a needed discussion. And Maria has made so many points that I could, start picking up on them and developing further. But I would like to go back first to that definition of One Health that you started us off with, and there are many, right? but eventually they all boil down to the health threats that we share with our fellow animals and fellow environment, right? And they include anything from zoonotic diseases over antimicrobial resistance that Maria has mentioned, over food safety and food security, environmental contamination, climate change, you name it. And in that sense, again, picking up on what Maria was saying, I think we will need more specialties than what we even are able to imagine. So Maria was mentioning social sciences and veterinary science and pharma how do we even call it? Pharmaceutical sciences, biology, but also agriculture, food production, climate scientists. We really need to be speaking the same language, and that's not going to be easy. And if we go just back to the example of the AMR that Maria was mentioning, it is a super complicated issue on its own. It is like the AMR takes a One Health approach in a way that we can't still. I don't think we can properly grasp it, because the AMR has a complexity of its own that stems from its own multifaceted nature. It on its own intersects human, animal, and environmental health. It has a huge potential to unravel the decades of medical progress that we were making, and it damages the environment and the world around us. And then if you think of the AMR as a public health emergency, it is not only public health emergency, it is also economic emergency. It is also a social threat. So we will need to be able to speak the same language with many more specialties, if you want. And if you think how everything is interconnected, if we go to I mentioned agriculture, and I think we are all very aware of the AMR crisis in human health, right? We don't need to discuss that. We don't need to talk about misuse, overuse of antibiotics. I think we all have a decent understanding of that. But if we think of the animal husbandry, the use of antibiotics to promote growth of animals and prevent disease is huge contributor to the antimicrobial resistance. But then we also have the pharmaceuticals and agricultural runoff of antibiotics into the land and water systems, and that creates reservoirs of resistant bacteria. But then we also have climate change on top of it. And we have the food systems transformation, and these two are already in a way in collision. So climate change on the one hand side helps spread the infectious diseases where they were not present before. It changes the ecosystems, and it influences the effectiveness of antimicrobial treatments. It affects the food production, and then the food production as it on its own, on the one hand side, contributes to the development of non-communicable diseases, and on the other hand side, the antimicrobial resistance limits the treatment of non-communicable diseases or of infectious diseases as a secondary complication in chronic diseases. So it is so super interconnected that only the One Health approach can help. And then you already see the movement globally, and we can talk about that later, and we can refer to the UNGA declaration. But how can we talk all together, and what's the role of civil society? Maybe just shortly on that. I really think that that the civil society has a critical role in ensuring the health equity and the human rights aspects of One Health approach, any of the crises that need to be tackled by One Health approach. And there are numerous organizations in Europe and in globally that are already taking action on that. I mean, Eric is here with us today. They do amazing work in Healthcare Without Harm. There is REACT. There is a number of organizations. And what is it that we can do? The first thing is, of course, raising awareness. among other civil society organizations, among citizens, among professionals, be they healthcare professionals, food and agriculture professionals, patient organizations, policymakers, and the awareness is about the importance of the One Health approach. Then we also need to redo the narrative. I think narrative needs a makeover in order for everyone to have it more relatable and more familiar. Also, our role is in prioritizing the One Health approach on the national and regional level. It is big on global agenda, it is big on EU agenda, but I think we need to make sure that it is really high priority on the national and regional level. It is our role to promote the transparent evidence-based policy making, and it is our role to translate research that is done by the likes of Maria and colleagues into the policy recommendations. And I would say the final part of our role is to build communities for the action on One Health. Now, for all that to happen, I guess I don't need to stress it in these circumstances, is that civil society needs support, it needs sustainable funding, it needs supports from the governments, but then I'm preaching to the converted, right? So I don't need to stress that, but I just need to pass that message for the record. Over to you, Zach.
You, and of course, as you mentioned at the very beginning, it's an incredibly complex and topic with immense numbers of challenges, and in essence, it's a wicked problem. And I really appreciate the fantastic way that you've kind of showcased how complex, even just for a topic that's a bit more narrow, like antimicrobial resistance, it can still be incredibly complicated to address all of the stakeholders that need to be addressed. We're talking about funding, reaching outside of the health sector to be able to effectively communicate. And actually, sticking on that topic, we'll keep the complex, challenging questions going. I'll pass it to Eric because you mentioned as well. He's been working kind of directly in a practical sense on how to address the topic of AMR, how to build a consensus. So Eric, would you mind sharing us a little bit some of the work that you've been doing, some of your experiences with the AMR Educare project, and some of your more broader work with Healthcare Without Harm?
Hi, Zach. Yeah, happy to do that. Well, first, I wanted to stress that obviously the need for streamlining One Health it's evident, and let's even see this event, right? It tells a lot that today we are here, all of us, talking about One Health, and you even needed to add an introductory phrase explaining what One Health is. It's like going to a cardiologist congress and say, hey, but let's first discuss what the heart attack is. So it means that we should know that, we should know what One Health is, but we are not there yet, unfortunately. Echoing a bit what Mika said, in terms of AMR in the environment, which is the aspect that we work on, there is not even monitoring at the EU level. Like there is no current monitoring going on resistant bacteria, resistant genes. There are many files, such as the priority list for groundwater and surface waters that are not being prioritized, lists that were supposed to be updated every 6 years, and the last time that they were updated was 11 years ago. So it's a dangerous situation. Like all of us acknowledge the issue of One Health and how important it is to bring everyone on this same boat, but then at the same time we don't put the resources where we need to put them. So that's something that it's tricky. Also, Milka mentioned the use of antibiotics in food production, and worldwide it's, I think, estimated around 70% of the antibiotics used are used in food production. It's not the same figure for Europe, where it's around 50%. I think it's a bit lower, the use in animals than the use in humans. But also looking at how they are being used, there are some concerns that are raised, right? Like, for example, there is this ban of routine use of antibiotics, which needs to be monitored, and we need to make sure that the implementation is adequate, because still the amount of antibiotics sold for group treatment is overwhelmingly higher than the one used for individual treatment. I think it's 80-20. So it tells a lot on how antibiotics are being used right now. And also very important, as also Mika and Dr. Jeff Kitts say at the beginning, raising awareness. That's something that it's crucial. And going back to the question you asked me, because I've been talking for 2 minutes without answering your question. Last year, we were funded with the European Commission support to develop a project called the EHMA Educare, where we are planning to train around 4,000 healthcare professionals in Europe. This is in 6 priority countries, and it's an action that started last year, as I said, but we will start with the trainings at the beginning of 2025. And in these trainings that we are designing, for us, it was very important to incorporate the One Health approach and also to incorporate health managers, because usually, when there are trainings on antibiotic reduction, usually are more the stewardship part, and they incorporate usually mostly doctors, nurses sometimes. And in this one, we really wanted to make the link and to make the clear link between the use of antibiotics and the impact in different areas, let's say. The impact obviously in healthcare facilities, but also the impact in the environment, and how there is a clear link between the use of antibiotics and the development of resistance. Actually, that's the main cause of antibiotic resistance, right? The use of antibiotics, which makes sense, and we need to use them. But we need also to understand which are the let's say, the life cycle of a pharmaceutical product, in this case, antibiotic. And an antibiotic, when we take it, our body doesn't absorb the whole product. So it gets excreted into the environment as a active substance. And this has many, many impacts in the environment. It can affect some very common processes that happen into nature, like nitrification and denitrification. But it can also, the environment can also act as a reservoir of resistant bacteria. It's especially concerning in many countries where hospitals don't even have wastewater treatment plants. So the water from the hospital goes through a pipe to the wastewater treatment plant, where joins the water coming from industry, the water coming from agriculture, the water coming from urban use. So in the end, we have there a mix of different bacteria and also different compounds, pharmaceutical compounds, but also chemical compounds. So in this EHMA Educare training, we want them to be aware of this connection and to be aware of the impact that has the correct use of antibiotics in reducing the acceleration of AMR. It's not only at the facility level, it has a wider impact that we want to address.
That actually brings me back to something you said a bit earlier when you were introducing the project. The idea of reaching 4,000 healthcare professionals in 6 different countries had me kind of ringing the bells of thinking, it's very difficult to have clinicians change their practice. It's even more difficult to have cultural changes of practice, which is, I think, in essence, what we're talking about here within different health facilities and health systems. So I'm wondering what your experience has been like. I suppose building a consortium, which types of specialties are you trying to involve? Have you had difficulties having them interact with each other? Is there differences in how you want to approach clinicians with this information and training as opposed to health managers? And I suppose, what your experiences and even some of your challenges have been so far?
Yeah, well, I guess that the first big challenge is forming the consortium. In our case, we try to gather as many experts as possible in clinical settings, but also experts in behavioral change, experts in digital skills and digital tools. So the idea was to create this training that was as easy to implement as possible and obviously as impactful as possible. So we don't want 4,000 people to take our courses, then go home, forget everything, go back to work and still keep doing the same things that they were doing before. So the training has a strong focus on behavioral change. And this has been ensured by a university in Lisbon who has an expertise in behavioral change. And then each of the modules, so we have 3 modules. One is on antibiotic stewardship, the other one is on waste management, and the third one is in patient communication and empowerment. So in the first one, we had a group of 6 different universities working together from the 6 countries and the health system in Spain. So they discussed about the content that they had to include. Once this content was ready, we also shared it with an external group of experts. So these experts were able to give feedback to that. In the case of the waste management one, which is the one that we coordinated, the process was slightly different. We got involved several healthcare experts, waste experts, in a workshop that we organized in Lisbon. We discussed together which were the most important things that should be incorporated, because at first we had a very technical view of the topic. And when we had the meetings with these experts, they were saying, wait, many healthcare professionals might not be aware of what this is. So perhaps you should have a very basic introductory module where you explain all these. And some of them actually don't really care about the very complex issues. They want like specific, very easy to apply practices. And these practices might vary from country to country. So there were a lot of things that we needed to consider. We build the content, then we share with the working groups again. And when the working groups send it back to us, now we are actually in the process of talking to the different countries, discussing with them which are their necessities, which are the things that should be changed, because some countries might have different guidelines. And it's a process of constant feedback, like back and forth. Takes a bit long and it's tiring, but it's we are confident that the result is being really, really good.
Appreciate you kind of diving a little bit further in depth into that, because it also raises another question for me that I would like to throw back to Maria and actually eventually to Milka as well, because this is a project that's been funded by the EU Commission, if I'm not mistaken. So it's obviously a great initiative and one that is funded, but obviously our investment in public health as a whole, I think we can all agree, is chronically underfunded. And even after something that might have been considered a wake-up call, like the COVID-19 pandemic, we still see that it's difficult to convince policymakers and decision makers that public health, even though it has been proven to be a good investment, so preventive care, things like vaccines and things like you said, better waste management, better medication management, these are good investments, but we still somehow are struggling to get that message across. And I think that's part of the kind of complex topic of One Health, is how we can make this an attractive concept to people who make the decisions about funding. I know it's not our favorite thing to talk about, but it's important, because One Health is, I suppose, just another item on top of the pile for people who see public health as a side note for perhaps for their healthcare spending budget. So Maria, I'm curious from your perspective, looking for research funding and things like that, perhaps from that angle first, how that's been, how you see that challenge.
So I can say that we already mentioned as a main limitations in our paper financial constraints and the limitability of some financial resources and also cultural and institutional resistance. So entire healthcare institutions, we have also resistance on these topics like One Health approach. For example, we already in Serbia, we organized the last 7 years One Health Symposium every 3rd of November. This year it was organized on Friday, 1st November. And I mentioned that there were a lot of experts. We organized that in Academy of Medical Sciences together with One Health Association Serbia. It means professionals and citizens which are interested in One Health approach. And our colleagues from clinical medicine. And I mentioned that we are not infected yet, our colleagues from clinical medicine with One Health approach. So we need to work not only outside of healthcare institution, but also deeply inside of healthcare with our colleagues, which are not recognized enough. When you ask for financial support, I would like to mention that we have a chance to increase our impact with Horizon Call and One Health topic. It is a challenge and it is difficult, but it's possible. So I think that it's also important. Without partnership with clinical medicine and citizens, we cannot achieve anything. And of course, one colleague from Faculty of Sciences on Friday, when I mentioned biodiversity, I'm very lonely when I mention biodiversity in my healthcare community. They didn't understand me, but my colleague from Faculty of Sciences said, yes, we need to talk about biodiversity because our planet, we need to heal planet in One Health approach. And we will solve resources, financial resources also if we use One Health approach. Yes, I'm coming from environmental health field, and I should mention, for example, waste management. It's not only healthcare facilities challenge, it's also environmental challenge, it's also One Health challenge.
Indeed,
so,
and
this is also the common issue for all of us.
It actually sparks an example to my mind, the idea that biodiversity is also important for the medicines we have access to, because a lot of our medicines are derived from rare or threatened plant species. So this is even a way we could talk about biodiversity as critical.
We can find traces of antibiotics in surface water. We can find in the soil. We need regenerative agriculture. We have a lot of problems with safe food and security in food production. So this is also One Health challenge.
Indeed, and as I promised, Milka, I'll come to you with the same kind of question about funding. I know you're working in a space where you're working with a lot of different actors who have a lot of different interests. And of course, everybody competes for limited funding for their own priorities. So I wonder what the challenge you see in basically building a consensus around how we describe One Health, how we describe it specifically to people who make decisions around funding, and how we get everyone to agree that, you know, some of their precious limited funding can be directed towards this, and it will still be a benefit for their goals and common aims in the end.
Thank you, Zach. I think that's exactly what I was referring to when I was saying we need to adjust our narrative, because we keep talking about the challenges, and the challenges are many and interconnected and super complex, and they're not going to be easy to detangle. But I think we need to start talking more about the solutions and about the win-wins and about what is it that we will achieve were we to take the One Health approach. And if you think of taking the One Health approach on the example again of the AMR, but there are many other examples from waste management onwards, like there is a very clear economic benefit if we take the One Health approach in tackling the AMR. And there was a recent study that says that the drug-resistant pathogens can jeopardize our food supply for more than 2 billion of us, and that they will increase the healthcare cost by around 160 billion euro annually by 2050. But then the same modeling did the calculation and estimated that for each US dollar invested, there is a return of 28 if it's invested in One Health approach. So in drug innovation on the one hand side, and healthcare improvements on the other. So that's the economic benefit. That is what we can use as an argument in our kind of win-win narrative. Then there is, of course, the environmental argument. Of course, the One Health approach helps safeguard public health, but it also helps safeguard the ecosystems that Maria was talking about from the consequences of this unconstrained antimicrobial use. And then if we apply better waste management and if we regulate the antibiotic use in agriculture, then we will reduce the contamination of the ecosystems, and that will be crucial for maintaining the environmental health. And then I started with that when I was talking about the role of civil society, but I think that's a critical win as well. And that is that complex issues like the AMR always affect most those that are most vulnerable. So by using the One Health approach, we will be able to directly support the reduction in health inequalities and improve access to healthcare and promote equity in health outcomes globally. So we are directly working towards like removing the threat on human rights that the AMR and alike are posing. So that is what I was thinking when I said we need to adjust our narrative. I would like us as a community to more highlight the wins. And when you come with the wins and with the right wins to the right stakeholders, then there will be the right funding for the right approaches. Or, yeah, call me idealistic.
Completely agree, because if we can frame it as something of sustainability and equity, I think that's something that everyone can agree is a priority and everyone wants to work towards. So I think that is a very good starting point and even a good key take-home message for those of you taking notes at home. But actually, I think it's a good time to put to Eric one of the questions from the audience. So Annalise has asked a couple of questions about waste management, because I know all three of you have mentioned it, but perhaps it's valuable to dive into what that really means. So obviously you mentioned, Eric, the idea of the excretion of antibiotics, but can you give a bit more detail about what better waste management entails, what good practices might look like, and essentially how that's being handled right now?
Yeah, that's a very broad question, but I will try to be concise. We need to take first into account that when talking about healthcare facilities, the journey of a patient inside the healthcare facility has an impact, as every human activity does, but in this case, this person is exposed to different agents. So first of all, there is the management, let's say, of the excretion of these patients, or the most like let's say when the substance enters in the body and needs to go out of the body, which is actually the hidden part right now, like it's a bit invisible. As I said, many hospitals don't have wastewater treatment plants, but there are other things that are quite let's say evident. Like, for example, all the materials that are being used, all the organic fluids that are extracted or that are used for, I don't know, blood transfusion, for example, many things. All the, let's say, the waste that is produced, from waste that it's more like common waste to waste that it's like more agents, I don't know, cytostatic drugs, different kind of liquid treatment that it's not fully given to the patient. All these compounds need to be addressed and managed properly. I know that we are not in a phase where we throw everything to the same bin. That every hospital, or almost every hospital, has a different company working managing the waste, or perhaps I am wrong, and some people there can tell me that I'm wrong. But there are many things that we don't think of. For example, the materials that we use to clean the surfaces, that's something that also has an impact. So when we talk about waste management, in the case of this specific training program, we talk from a broader perspective. Again, like the whole path that a patient does and all the waste that is produced in this path, how to address it properly. And then when this waste is produced, how to dispose of that correctly, because obviously there are many ways of disposing of these medical waste, and not all of them are equally sustainable.
Thank you. And let's say that idea that we've now switched from, we were talking about collaboration, research, waste management, financing. I think the general arc of our conversation has really shown how broad and how complicated this topic is. And I'm going to risk complicating it just a little bit further, but with the aim of maybe bringing us back to a place where we can maybe find agreement on some concrete solutions. So for me, what stands out, and I think all three of you mentioned it to some extent, is that there's equity concerns, there's sustainability concerns. For me, I wonder if we even consider the idea of digital health and if that should be considered as part of One Health. So, for example, technologies we incorporate into our health systems, maybe to manage medications better. Those obviously have a direct influence on some of these One Health concepts. But even economics, so we're talking procurement decisions. So if we decide to save money by ordering a product that maybe generates more plastic waste, takes a little bit longer to arrive, so more transportation pollution, but saves us money, I think those are also considerations that are part of the overall One Health spectrum, but maybe aren't necessarily directly said at the moment. So given that, I can probably go on for a while, and I'm sure all of you can as well, with some of these examples that really complicate it even further. I'd like to boil us back down, because rather than trying to be overwhelmed by all of the different possibilities, I wonder if there's an approach, maybe from some practical examples or success stories, where you've seen One Health management kind of boiled down into bite-sized chunks, things that are easier to manage. I know, so AMR Educare is a good example of really focusing on one specific example. But other ideas or examples from your practice, I think, would be a really good way to end on a positive note, that there are things we can do. And, this is not a topic that has to expand infinitely. We can address it in manageable sections. So perhaps, Maria, I can start with you.
Okay, the first positive example is, for me, is education, trying to find a way to improve curricula at universities, interdisciplinary approach, communication and cooperation among different universities and different faculties, entire one university. For example, Faculty of Agriculture, Faculty of Medicine, Faculty of Natural Sciences, and Faculty of Veterinary Medicine, we should work together, and we can use One Health approach. It is also in some way money-solving resources, because we are working together. So this is one example. The second one, maybe in waste management, when we use some citizens approach and partnership to bring pharmaceuticals with in a household, to bring together, not to find out at the end in environment, cycle, in surface water, in soil, etc. This is also, and cooperation with the, for example, European Medical Agency, for example, but without cooperation with industry of agriculture, I think that it's also crucial. We cannot solve challenges of antimicrobial resistance, for example, and other challenges. But if we want to go into the solution, we need to educate future engineers in One Health approach, and they will be prepared for future production and to save soil, regenerative agriculture, etc. So we need to prepare for big changes in educational process, and of course to change procedures in urban health approach also, with some procedures to save our built environment. And also, for example, solutions, we don't have, I think that we don't have a precise statistic with pets in urban area.
Mhm.
This is very big issue for common disease. So we now we have increase in obesity in pets and malignant disease in pets. So it's also we could find maybe could work together to find solution.
Completely agreed. And even to build on your point, and actually, Milka, one you made earlier, I know we've listed quite a few professionals from outside of the health sector, agriculture, farms, that we can talk about urban planners, architects, educators. I wonder from your perspective if you've seen any models for collaboration or methods that really work well to bring actors from outside of the health sector into these conversations.
We actually do it. We host a network which is called the AMR Stakeholder Network that started in 2017 as part of or on the basis of the EU Health Policy Platform. And it really gathers very versatile specialties among our membership. And you were asking for some examples of good practices, and that is what we tried to do a couple of years ago. And we actually published a collection of best practices in the area of AMR using the One Health approach. And I will find it and I will share a link in the chat before the end of this meeting. And if I'm not mistaken, what came out of that, so we opened a call for good practices and we collated, I think, 40-ish of them, grouping them into those related to human and animal health. And I think the learning was that there was less awareness of the environmental health. At least I think it was published 2 years ago, so at least then. But I think that awareness is on the rise now. So there are examples of good projects on the ground related to human and animal health. There is an increasing number of examples now related to the environmental health, but we need to keep raising awareness. But I will find the link in a second, and I will share it with you all just to see, just so that you know. What's happening there. And apart from the AMR stakeholder network that IFA hosts, there is also an AMR MEP interest group that we co-host with Healthcare Without Harm, and that we are now, going to try to revive with the new parliament in place. And that also brings together different backgrounds coupled with a political interest and political will. And that also helps.
Great, thank you. And I'll give you the chance now to find those links, because I'll pass the floor to Eric. And similarly, so Eric, I mean, a lot of us here work really in the European context. And when we talk about trying to bring in stakeholders from different areas, I think we really think European if we're working in this area. But I know Healthcare Without Harm has a bit more of a global reach. So from your side, I'm curious what we as more European focused organizations and institutions can learn from a more globally focused organization, because in the end, One Health means One Health, so that doesn't just mean Europe.
Yeah, thank you, Zach. Well, actually, I am working in the Healthcare Without Harm Europe office, so my perspective is also mostly European, although it's clear that we need a global focus. And just reflecting, for example, on some very basic things, like how much does a box of antibiotics cost in Belgium versus how much a coffee costs in Belgium, you would be surprised how many coffee shops are more expensive than a box of antibiotics, which need a lot of production. They come from different regions of the world, mainly from India and China. And if we are not paying the cost of that, it means that other people are paying the costs, which again brings back us to the environment and the impacts of let's say, the production and consumption of medicines, which are essential for us and animals, as we say, and even plants and the environment. But have a very big impact in other areas of the world. That's also something that some researchers are calling green sacrifice zones. So zones where we outsource our production and let's say they bear the impacts of things that are being produced here, and they bear the impacts of many things that we want to use to be more sustainable, like for what happens with the production of batteries, of solar and rechargeable battery cars in Europe, right? The resources come from elsewhere. But bringing it back to medicines, I think it's really important the work that many countries are doing in terms of sustainable procurement. And I'm thinking especially about the Nordic countries. They have very strong procurement practices in place, and I think that's actually one of the keys to let's say reduce the impact of pharmaceutical pollution, address some specific challenges such as antimicrobial resistance, and for that we need buyers that actually want to bear the responsibility, and buyers that want to perhaps not buy it at the cheapest price, but buy the things at a very fair price. And I don't want to extend myself, but I know that there is also this Critical Medicines Alliance been discussing how to reshore some production to Europe, or if that was feasible. So these are debates that will pop up in the next few years. That they are already popping up, but they will pop up more intensely in the next few years.
Thank you. And I think that's also a really good way to kind of move us into a bit of a closing here. So I'm going to challenge each of you one last time in 30 seconds to 1 minute to just give, let's call it your key message. I know you're all working on this topic in some capacity, but what you think your priority or our priority needs to be moving forward. So Maria, I'll start with you. Sorry, you're on mute. You're on mute, Maria. Maria, you're muted if you can.
Sorry. I think that the One Health principle and approach we can use as a driver for increasing efficiency in health management.
Thank you. And Milka?
Zach, you should have prepared us for this. So I will not use my own thought. I will quote a WHO colleague who runs their AMR work in Copenhagen, who says regarding the AMR and One Health, he says, we don't have to do everything together, but together we have to do everything.
Thank you. And Eric?
Well, you cannot ask me to intervene after Milka's wonderful phrase. I was about to say that we definitely need more environmental monitoring. Like, we need to know how pathogens interact in the environment, and we need to understand the environment as what it is. It's part of our life. It's part of our of the services that we receive from nature. So it means that we really need, when we look at different human health challenges, we need to look it through this lens. And I'm not saying a green lens, I mean a One Health lens. Yeah, you name the color that you want this lens to be, but we need to look at it from this lens.
Thank you. And thank you all for that final intervention, because I also think it highlights kind of the beauty and the real interest behind this topic, is that no matter what you're interested in, there's something in One Health that you could find passion about. I know for myself that's personally true, and I'm sure it is for most of you in the audience. And I'd really like to give a warm thank you, and hopefully you can extend a digital round of applause to our 3 speakers today for sharing their insights, maybe being let's say cordial with me, putting them on the spot here and there. And I hope we can continue to have some of these conversations in the future. And of course, I can't end without my final plug for our report, which is showcasing the new definition we've created for One Health management. And again, you can find the link in the chat, and we'll look forward to continuing this conversation another time. So thank you all for being here. A special thank you to our speakers.
Thank you very much.
Thank you. Bye, everyone.